So we are live now.
Welcome to the last and most important module, which is going to speak about the building and governing clinical AI teams in real life. Very important topic, and we are very fortunate to have one of the most eminent speakers, Dr. Rajendra Pratap Gupta, who is the person who started Health Parliament and everything, and he is one of the pioneers in starting a digital health in India way back almost a decade and a half ago. But unfortunately, because he is supposed to deliver a lecture in Mayo Clinic, he shared his recorded version to us. We are going to listen to that. And we have equally eminent personality, Mr. Venkat. We fondly call him Venkat. He is Venkateswaran Mahadevan from IgnitAI, who worked deeply in the same segment to moderate and then answer most of the questions, whatever you have. So please keep posting your queries in the YouTube chat box. Please do not post your codes or anything else. Don't spam them. I kindly and humbly request it. And today you are going to have assessment of today's session only, which will be there up to 8 p.m. And from tomorrow, 12 o'clock, you have the formative assessment as detailed in the YouTube. National Board, over to you for the video presentation.
Good evening and greetings from Los Angeles. I'm really fortunate to the National Board of Examinations for starting this wonderful course. And I am happy and I would say lucky to share about the work I have done in the field of artificial intelligence by creating the functional AI pyramid model, the AI machinery model framework, of which I'm going to talk about. I know that you all have to play a key role in governance of AI and teams. But you can't govern unless you understand the scale and scope of what AI will do when it integrates with your work through its functionality. And you can only govern if you know the larger picture and the granularity at the same time. And my job is to get that clarity across to you through this lecture, which I understand is the last lecture in the series, but not the least important one. It could be the most important one. I keep saying that, AI will impact you not in a decade, in this decade. That means you actually have 3 years to catch up. And AI is a trending topic, so everyone goes for it, and no harm. But I would insist that please consider digital health as a broader specialization, no matter which specialty you belong to, because AI is a subset of that. And I'm going to walk you through that. And it should be everyone's specialization. So the disclaimer is I would give just a brief sense of that this is taken from the larger course that I run, the full course at the Academy of Digital Health Sciences for senior clinicians and healthcare professionals. And I have trimmed it down to a very small portion, just this particular lecture. And since this is original work, so I would professionally expect that if you desire to quote it or use it in whole or in parts, you should attribute to the author and creator. A brief about me that I have been in this field for little over 3 decades. I had a chance to work on the digital health for a fairly long time, being involved in drafting the first guideline of the WHO for digital health, creating the Global Digital Health Index, which became the Global Digital Health Monitor adopted by the World Health Organization. I was also invited by the Prime Minister's Office of Bangladesh in 2019 to help them draft their AI policy. I also chair the Commonwealth AI Consortium for Capacity Building, and I have been on major initiatives of digital health at almost all multilateral bodies. I chair the Dynamic Coalition on Digital Health at the Internet Governance Forum, which is a specialized body of the United Nations with permanent mandate on internet and internet technologies. Last month, I was also nominated by the Secretary General of United Nations, Antonio Guterres, on the multi-stakeholder advisory group of the Internet Governance Forum at United Nations. And this shapes the global dialogue on digital technologies and also the multi-stakeholder consultations, in fact, shaping the digital economy in today's time. When it comes to governance, 2 decades ago, I did my corporate governance from Kellogg's in the United States, and I continue to leverage my experience in corporate governance in the corporate world, in public sector, and now in AI. I'm an author of 5 books, two of which are on health. One is on digital health, which still remains the most comprehensive book ever written on this domain of digital health, and is also a course book in some countries. And this also gives me opportunity to teach digital health across the globe. I've been a part of various reports of the WHO, and also developing the roadmap for telemedicine under Innovation Group Asia, which was appointed by the UN Secretary General more than a decade ago. And I developed the Global Digital Health Index, which was adopted by the World Health Organization as the Global Digital Health Monitor. I did along with my 12 other colleagues. And when it comes to trainings in digital health, I could see that very early on. In the last decade, I launched the Academy of Digital Health Sciences with global experts, as you can see, and Health Parliament. This was much before COVID, because I could see that digital health would be integral to healthcare delivery in the coming years, and COVID just fast-tracked that. I've also served as advisor to the Health Minister of India, and two of the key policies that probably impact you are the National Health Policy 2017 and the National Education Policy 2020. So you have seen a lot of initiatives coming as a result of that, which includes the National Digital Health Mission, the Ayushman Bharat Digital Mission. One thing I have always championed that not knowing digital technology is actually a disability, and I call it digital disability, which is something we must address with a high priority. This is my favorite slide, and I know that you all know Apple as a company that makes iWatch, iPads, Mac, and iPhones. But just hear out this 12-second video of their CEO Tim Cook on what he says.
If you zoom out into the future and you look back and you ask the question, what was Apple's greatest contribution to mankind? It will be about health.
So as you hear from Tim Cook, he says that if you look back, the biggest contribution of Apple to mankind would be about health. And this is not just Tim. I think is every trillion-dollar company has a focus on health. So the message I want to give to each one of you is that if the tech companies are looking at health as their biggest contribution, and if you don't adopt technology, definitely they're going to invade your turf. So it's imperative upon us to make sure that we adopt technologies before they start adopting health as their core competence. And now comes to what has not been taught to us, but that's been a reality for 6 or 7 decades. So this is Gordon Moore, the chairman emeritus of Intel, and one who coined the Moore's law. This is Moore's law, actually. So according to Gordon Moore, the computing power doubled every 24 months, 2 years. This was never taught to us, but this is like more than 6 decades old. And then this is Buckminster-Fuller curve. If you look at this, the information which doubled every 500 years in 15th century has been doubling every 12 hours. And now after generative AI, I'm sure every few hours. And if this is not enough, the next slide will tell you that what's going on. If you look at the model release timelines of OpenAI, Anthropic, and Google, this is down to less than 2 months. So most of us who did our degrees decades ago, or probably some of you did years ago, you're living in an age where the models that govern the information society, they govern the data, are rewiring, revalidating, reinventing less than 2 months, every 2 months. So please don't, believe that what you did in the past is good enough. Technology is reduced the span of development from few years to few weeks, as I say, and this is a living proof of that. Even if you look at this slide, the human expert level, which is the violet line you see, the technology surpassed human intelligence in 2023. So this is more than 3 years ago. So all of us have to live with this reality that we need to have technology as a friend and a guide and probably an assistant and not stay out of it. As I said in the beginning, AI is not a standalone technology. It is a collaborative technology. So those who focus only on AI will learn only a tool. But those who master digital health will know how to fully leverage AI because they'll be able to use AI along with other technologies. And that's why I personally was very keen that every clinician, every healthcare professional should be trained in the broader domain of digital health. And that's why I set up the Academy of Digital Health Sciences in the last decade. And we have trained hundreds of clinicians, fairly senior, some of whom have got over 50 years of practice. Just understand that. Average experience is 20 years in our courses. I need to give you an understanding of the digital health building blocks before I jump into the AI maturity model. And I'm doing it with a very clear intent. When I look at some of the advertisements, not just in India, but even in Europe, even in US, they will write digital health and telemedicine. They will write digital health and artificial intelligence. And sometimes it is very frustrating for someone like me who has been involved in this domain, that if you're writing digital health, why would you put a suffix? And you look at the building blocks and you will get a clarity on that. So the first building block of digital health is the healthcare information technology, the cloud, digital health records, patient portals, hospital management information system, and other software solutions. The next is the wearables, IoT, medical devices, point of care devices. Data analytics, AI, and machine learning, which is both generative AI, multimodal AI, blockchain, chatbots, large language models, and large action models. Then genomics, nanomedicine, predictive precision, personalized medicine, and quantum computing. Ethics, privacy, and security. AR, VR, MR, metaverse, gaming, robotics, drones, and 3D printing. Mobile health, digital consultations, and then consumer digital therapeutics, prescription digital therapeutics. So just imagine that. That's why I keep saying AI is not a standalone technology. It's a collaborative technology that works with all that you are seeing here. So you need to learn the broader domain of digital health and not just AI. And also that the building blocks are the subset of the digital health ecosystem, which is a much broader domain. In the interest of time, I'm not going to give you a slide or description on digital health ecosystem, which is a part of a bigger course, and it could be a much longer lecture. So I've just given you a sense of the building blocks. There is a bigger digital health ecosystem that you all should understand as clinicians. Also, I need to give you clarity on three words. And again, I say it's not just India. Even if we go to developed parts of the world like Europe or US, the response is same. If I ask people what is the difference between digitalization, and digital transformation, it's very hard to get a response. So I'm going to get that clear to you in the next two slides. In the simplest one word, digitization is conversion, which is analog to digital. Digitalization is adaptation, where you can actually go beyond the analog to digital. And digital transformation is creation. Now, the next slide will give you examples. So digitization is when you take a paper record and you scan it, you have digitized the information, but you can't run analytics on that. Digitalization is electronic health record. So you can run analytics, you can use a couple of things on that information, and the process gets automated. You have streamlined the process. And digital transformation is when you do a teleconsultation on that. So you get a sense like in digital transformation, you cannot do without digitalization. Digitalization, you can't do without digitization. So this gives you the difference between three. Now let me jump to the functional AI pyramid. This topic, it is very interesting. And I remember last year I was in Spain addressing a couple of thousand clinicians. And then back in South America, in Cali, in Colombia, where I asked the same questions. How many of you use AI? Almost all hands go up in the room. And when I asked them, can you tell me the 5 levels of AI? Not a single person has been able to answer. Well, if you know the 5 levels of AI today, then probably you are the lucky one. But what I'm presenting you today is based on actual intelligence on artificial intelligence. What I say that is that this is as a result of the work that I have done in
Sorry for the small glitch. Just for the information of the students, uh, so whatever you're going to hear from now is the proprietary work of Dr. Rajendra Pratap Singh, as he already gave it in the disclaimer that it is a patented proprietary work. So if anyone who want to use it in real life, you can record it, but with all due credits and references being made to Professor Rajendra Pratap Singh, because this is something which no one in the world knew. It is his own work from the Health Parliament, which he presented in the World Health Organization. Currently, is doing it in the Mayo clinics everywhere. It is, we are very fortunate to have such a great work. So I intentionally paused it for a minute. This is a 5 pyramid model. Please pay extra attention. And National Board, please, you can continue to play the video, right? So that people understand from here onwards, it's a proprietary thing, will be available publicly, but with all due credits being given to RP Gupta, you can use it. Over to you, National Board. Yeah.
and running a healthcare organization, you have to understand how AI progressively integrates into your practice in your organization. Unless you know that pathway, you will not succeed. You will end up doing some blunder. But then there was nothing available in this understanding which a non-technical person could understand. And AI has been around for a fairly long time, since its uh, ideation in the late 50s. So the first level is conversational AI, AI that talks. I gave it the name of talker. So let me give you a analogy that you will understand, or an example. So if you buy something online today, and if you have to complain or get in touch with the supplier, you actually talk to a chatbot. Now that's conversational AI. That's an AI that talks. The timeline is it started in 2015, has reached scale in 2024. In the decade around 2007 or so, I joined the Mayo Clinic platform and Neuber Foundation joint venture as a medical advisor and served there for 8.5 years. So Mayo Clinic started implementing this around 2015 or earlier for their patients who underwent surgeries. So this has been a fairly mature technology and has been used in medical use and other fields for a fairly long time. And this is the first functional level of AI in deployment in healthcare, which is chatbots, virtual assistants, AI systems that can answer questions, provide information, carry out basic interactions, including healthcare symptom checkers. Uh, at this level, what happens is that you can build virtual health assistants to triage patients and handle initial patient queries, deploy chatbots for customer service, appointment scheduling, patient education, and engagement, employ multilingual conversational agent for global access to information, and use conversational agents for responding to queries for customers. So it will augment human communication, reduce cost. What it does is actually augments clinician-patient interaction in handling from one to one-to-many patients. So for hospital administrators, this will also help organizations to expand their outreach beyond the stipulated office hours and ease the appointment scheduling, and also assist patient educators and counselors in patient interactions, record keeping, documentation. So the beneficiaries are individual organizations and governments, any role which is about speaking, desk-based jobs, they can be handled by this technology, fairly mature. Any job that does not involve high-end motor skill will be up for augmentation first and elimination later. But at this stage, I think we have already started eliminating the jobs which are front office and back office. So this has been, they're fairly matured and technology deployed at scale. I believe every clinician stands to benefit, every hospital stands to benefit, every healthcare provider stands to benefit from the first level of AI. The second level of AI is the reasoning AI, AI that thinks. I give it the name of thinkers. While the first level of AI systems address motor and communication functions, the second level moves beyond to cognition. The thinker level AI performs logical reasoning, contextual analysis, and clinical decision support. Neurosymbolic AI reasons through complex clinical data, identifies patterns, and provides evidence-based recommendations. There are a lot of use cases in terms of what it augments and what it can do to human judgment. The timeline for this has been around 2023 to 2025. This second level of AI has found quite a good acceptance on clinical decision support system for diagnostics and treatment planning across specialties, aiding what I call medical decision making by clinicians, fraud detection in healthcare, chronic disease management, medical research and evidence synthesis, drug discovery, stimulating complex molecular interactions, optimization of organizational, technical, and human resources. In my view, this has huge impact on human judgment, and this will help in decision making in terms of differential diagnosis, treatment logic, and medical research evidence synthesis. It also helps in demand forecasting, predicting health outbreaks, optimizing inventory logic, primary care, adjusting treatment plans, and based on real-time data from variables, and chronic disease management through digital therapeutics and related tools. Clinicians, decision makers will immensely benefit from this level of AI. And I think the biggest beneficiary would be the accuracy in primary care, early detection, diagnosis, clinical judgment, improvement in quality of interactions, and clinical outcomes. This takes us to the next level of AI, autonomous AI, AI that acts. I gave it the name of doers. I was involved in 2024, 2025 to build this with one of the most celebrated digital health entrepreneurs of our time. And we implemented this, and I was pleasantly surprised to see the quality of interactions. It almost looked like clinician talking to a patient. You know, for me, this was something unexpected but positive. At this level of autonomous AI, AI systems perform tasks without continuous human oversight, combining perception, reasoning, and decision making to execute complex healthcare functions independently, including robotic surgery. So the conversational AI communicates with reasoning AI. Equipped with all these capabilities, the AI now starts to act. My sense is that between last year and till 2027, this would have reached phenomenal scale in healthcare. The use cases of this are AI scribes, robotic surgery with minimal human intervention, autonomous management of routine follow-ups and care coordination, replacement of selected touch points across the continuum of care. Well, that's the reality of where healthcare is headed. I would even go to the extent of saying that it may replace conventional electronic health records with intelligent patient portals that will go on beyond recording the line of treatment. This finally augments human execution and eventually will start replacing it too. That's the harsh reality. So it'll augment the clinical trials design, supply chain, resilience planning, helping clinicians and healthcare leaders with foresight and logic. It will benefit organization and citizens. Of course, the biggest beneficiary in my sense will be clinicians' time and care outcomes. Patients, clinician organization will become efficient, will be able to get the right information on right time and drastically change the healthcare supply chains. This will reduce the clinicians' burnout, improve eye contact, and move healthcare from a black box to glass box, as I said. Very excited about this level, but one level that I'm most excited about is the level 4. And you can understand that as we have been moving up the level from talkers, thinkers, doers, and now innovators, which is AI that creates. So I gave it the name of creators. This level of AI has a very different role. As I said, none of us will be doing the things that we do today by 2030. I mean it. The timeline for this is 2027 to 2029 to be at scale. But this most transformative AI will move beyond execution to creation. These systems will be enabled by metacognitive functions. And I am very excited for one reason. When I founded the Academy of Digital Health Sciences, this was with the goal to address metacognition, which is thinking about thinking. These AI systems can generate new knowledge, new clinical pathways, new medical devices, new pharmaceuticals. And in my view, testing through blood samples would be a thing of the past, quite a possibility. And none of the conventional care delivery models would be the same when this gets in. Effectively, what this augments is phenomenal thing called imagination. So we started with human communication, moved to human judgment, human execution, human imagination. So far, we have been treating the phenotype. Now we will start treating the genotype. I'll also give you an example that we have the assembly line approach in medicine now. It works wonderfully for the pharmaceutical company. Anyone with a HbA1c of 7.2 or so on will get a typical glimepiride plus metformin. And now, of course, with newer treatments like semaglutide and others. But if two people do not even break the food in the same manner in the body, how will the same medications act on them? This level of AI will change that. I think I will not be wrong to say that 8 billion people can be treated in more than 8 billion ways, rather than the current form of 8 billion people being treated in one manner. In fact, the humanity at large will be benefited, but scientists, researchers, specialists, and senior management would be the biggest beneficiary. I think it will be the end of generalized treatment, as I would think. And this is where I believe we will be entering the golden age of medicine. So just imagine what you would be doing in this level of AI being implemented by 2029. The last level, organizational AI, AI that can run systems. While I give it the name of leaders because you can run an entire organization with AI. While I'm sitting today in Los Angeles and recording this lecture for you, but the 4 strategic business units of digital health associates ecosystem, the Academy of Digital Health Sciences, Health Parliament, International Patients Union, and Global Digital Health Summits are being run as an organization with AI. So I don't need to be there physically. And we are implementing this level of AI now, but my timeline for the healthcare and other systems is between 29 and 30. I think we will see the deployment at scale when entire organization can be run without continuous oversight. And this is, I would say, what I call institutional intelligence, coordinating across people, processes, and entire health ecosystem. This will be the age of hypercognition. And every individual in the system could have a hospital, not hospital, hospital. Most of the functions of hospitals will move to home with the people. And hospitals will only be left to manage accident and emergency, and probably surgeries. That will happen at the innovating AI level once we get it. And I think the 3-tiered healthcare system will go when this level of AI comes in, and will be fully replaced by an integrated, seamless care delivery model, AI-driven hospital administration and resource allocation at institutional scale, predictive health policy planning at national and global levels. And I think this will augment human leadership. So if you are talking of AI governance, and if you understood these 5 levels, of course, each of them have layers within. And this is our job at Academy of Digital Health Sciences, to prepare clinicians and healthcare leaders for 5 levels of AI and how to run practice and organizations in this age. Founders, CEOs, C-suite leaders, clinician, KOLs, scientists, insurance companies, public health leaders, and policymakers will be augmented by this level of AI. I think society at scale will be the beneficiary. I, in fact, call it the golden age of medicine. This is what I announced at the last Global Digital Health Summit in September when I unveiled this model. We will move from healthcare to health, from disease management to sustained human flourishing, and from symptomatic treatment to preemptive care, from hospital to hospital, and from patient-centric to health and human-centric. I think we will bridge the gap between longevity and health, which is today a huge gap. And all of you will witness something which we are witnessing today in our organization. We have more digital team members than physical team members. I think almost all organizations will have digital team members, which will exceed human team members, and this will happen by 2030. Now, let me sum up this in one slide for you. So, what has happened over the years when AI is maturing? You have passive agents that work within a defined framework, they are deterministic. We will move towards active agents, which have learned the process, become intelligent, they are non-deterministic. Generative AI has already moved to multimodal AI. Large language models have moved to large multimodal models, large reasoning models, and large action models now. Natural language processing, which used to be scribe, is moved to natural language programming. You actually don't need to know coding to do technology, to learn technology. This is what we exactly do through our courses. We had doctors with 50 years of medical practice when he joined our course. At the end of the course, he created his own tools and sent to his grandson in the US. And he had not learned the T of technology. He said, "Sir, I passed MBBS 50 years ago." So I think technology is simple as long as you're explained and taught in a very simple language. And that's our endeavor. And I'm glad NB, the National Board of Examination, has given us the opportunity to share this with you. So technologies will move from being deterministic to probabilistic. Technology will gradually replace tasks, then jobs, then people, and finally options that don't use technology. And that's why the message to you is start embracing technology and make it your force, not your fear. This is very interesting. When I analyzed last year, I think we would have come a few notches above. The AI of today was having an IQ of 155, Einstein at 160. My sense is in next 3 years, it could be 10x. So you could have an assistant with an IQ of 1600. Just imagine how powerful you would be if you understood the entire domain, how to leverage it. So if you thought this was like technology or economic change, sorry, it's not. I looked at history. Besides what I do, I am also a policymaker, so I track history. In large part of the first millennium and beyond, anyone who was strong in agriculture ran the world. They were strong economies. India had 1/4 of the world GDP, exactly as 27%. Things changed. Those who had firepower, they had the power. Military, US and UK, they ran the world. Now it is trade. That's why you're seeing trade wars, trying to contain trade, capture it. But we are headed towards technology. This is where the crux lies. But so you will think it is an economic or technology, and sorry, it is not. This is actually an intergenerational cultural societal change. Everyone has to change with society. So if you don't change as society changes, you get left behind out of the orbit. So we have to move with the society. If you thought I took you way back into history, let me bring you closer. 19th century industrial revolution replaced physical labor. And we are all mental labor. We don't do physical work. Technology revolution is replacing mental labor. So your competition is not your colleague. Your competition is technology. So you'll have to master it. You don't have a choice. Again, I say this, that in digital age, pride, ignorance, and arrogance have similar consequences. Of course, in our full lectures, I have 8 slides as an example of this. But in the interest of time, I am going to cut it and just say that no matter how old your practice has been or how many thousand patients you have treated, it really doesn't matter. Our research shows that patients are actually preferring clinicians who understand digital tools. And any professional who is confined to a desk-based work will increasingly cede their roles to algorithm. I'm very optimistic of what technologies will do. Technology create opportunities and opportunity create jobs. So digital health will bring phenomenal opportunities, but it's not a birthright, only if you master it. I say it is the great reset, the golden age of medicine. And I'm quite sure you as clinicians, if you learn technology fully, you will be the leaders in the golden age of medicine. 2 years ago at the Global Digital Health Summit, I started with my keynote and I ended with my keynote with this message. This is not the age of competitors. This is the age of creators. If you create, you will enjoy. If you compete, someone will outdo you. And we have created resources for you to use. So if you want to get updated on artificial intelligence, you can look up artificialintelligencenews.org. It's a newsletter which drops on your mailbox the way you want it. You don't have to pay for it. Thankfully, BDR Pharma has sponsored this. So no ads, nothing. You get the information you need at the time you need in the format you need. It's free for you, but paid for by someone. This book, Digital Health Truly Transformation, still remains the most comprehensive book ever written on digital health. You can check every specialty and the future of what's in it. For those who are looking at the hospital of the future, pharma of the future, clinician of the future, from 20 to 21st November at New Delhi at the Global Summit.health, you will witness live what the clinician of the future should look like, what the hospital of future should look like. And all that I have spoken today to you as a part of this lecture, the functional AI pyramid is a 25-page article that I have written detailing out what it means to you. You can download it free from the Help Parliament mobile app, which is available on Android and iOS. And though I couldn't join you live today, but I hope that I will get to meet you in person soon. And I thank once again the National Board of Examination for giving me this opportunity, and especially Dr. Suresh for accommodating my request to do it online. And I wish you all the very best. And I am sure that you, through your work, will lead not just medicine, but add glory to this wonderful, noble profession of medicine. Thank you so much.
Such a wonderful lecture, sir. We are very fortunate to have it, even though it is recorded one. National Board, you can stop the video. Now, a lot of questions were there. I'll try to sum it up. Mr. Venkat, are you online?
Yes, Dr. Suresh.
Wonderful. So, very interesting question which I faced is, if I just look as a whole, will the cost go up or down if I try to adopt AI in the
Dr. Suresh, one interruption. Yes, the whole screen has gone green for you. Yeah, now we are back. You can please proceed with the question.
Yeah. So, will the cost of AI adoption in a given hospital will go up or down? In which scenario, what will happen?
At the outset, Dr. Suresh and NBEMS, thank you for inviting me to this forum, right? And as Dr. RP Gupta said, embracing technology, as a force, right, and not out of fear is the mantra that all of us have to live by, right? So to kind of take on a set of questions now at the end of such a wonderful session with the 5-layered model that he has created, right? one of the first things is about the cost of AI, right? Now, I run an organization called IgnitAI in Bangalore, and in our organization, we do training and consulting across domains, including healthcare, right? Now, come to think about it, right? If you were to have an assistant, right, an executive assistant or a personal assistant in today's world who would help you do, a whole lot of regular work like making presentations, documentation, etc., right? The cost of such a resource would at least be about 5 lakhs to 10 lakhs, depending on the tier 1 or the tier 2 city that you're based out of. And I now know that across India, there are still these roles of executive assistant, personal assistant, chief of staff kind of roles still available, right? Now, let me bring in a large language model like a Grok or a Gemini, Claude, or ChatGPT, right? A paid version. A paid version, typically a very pro version, would cost about $20 per month, and $20 over a year into 12 would be $240 or $250, right? Even if we take it to be $300, that's hardly about 30K, less than 30K, about 25K per year, right? So at 25K per year, you are getting the work, phenomenal work, higher quality output, and an assistant or a resource that would never tire. You can abuse, beat, do whatever, right? So that explains, Dr. Suresh, the costing factor of AI. AI any day beats human beings in terms of costing.
Right. Got the answer very clearly. Can you give me one example where the innovation is done by AI, especially in the healthcare?
Very simple, right? Earlier, whether it's a hospital or a pharmacy or any of the online retail outlets like Big Basket. Earlier, when we used to go, there used to be a call center number associated with that for customer support service, right? Today, every website worth its name has got a chatbot associated. So as soon as you key in the website, you would be greeted with a chatbot asking what queries, right? And especially when it comes to in the space of healthcare, health insurance, etc., you just have to provide the insurance policy number, and any and every kind of query can easily be addressed by these chatbots. So that's a phenomenal productivity gain. It replaces what we call as a level 1 or a contact center representative or a customer support representative.
Wonderful, sir. One question, Mr. Venkat, is in the AI pyramid, after level 3, there is a lot of autonomy which is going on. So will it be covered under the regulations in terms of taking the responsibility of the patient care? Very futuristic questions. I don't have an answer. Very difficult to answer, but I want to take your views on that.
Sure, Dr. Suresh. So Dr. Gupta calls the level 4 as the innovating AI. He labels it as creators, right? So we may say, after all the brouhaha about AI, right, the only thing that is left for human beings is creativity. And when is that part of the human creativity going to be taken over by AI, right? And to me, right, it's going to happen sooner than later, right? It may not be immediate, but maybe 3 to 4 years down the line, as each of these LLMs starts gathering intelligence, gathering about all the information about us, it's able to put together, right? It is able to view patterns. At the end of the day, what is artificial intelligence or AI? It's a pattern generator, right? It observes the patterns in a very probabilistic manner. So when it starts putting together these patterns, so automatically innovation starts happening, right? So there will be new knowledge that would come up, or it may throw in a conversational kind of a way, it may throw a new kind of a pharma product and then say, hey, look, this is a combination. This is where innovation happens, right? The combination of drug A plus drug B is going to be drug C, which has not only the additional benefits of both the drugs, but over and above that, there is going to be, benefits which overrule either of the two, right? So see, greater than A plus B kind of innovations is where definitely AI will take us. But with a big caveat, unless we deeply understand how it operates beneath, right? How does, if we understand a model context protocol, or if we know how a large language model actually works probabilistically, we will be able to kind of, manage that beast. I call it the jujitsu with with all these AI and LLMs, right? If we know that technique, then we'll be able to produce innovation out of AI.
Perfect. So there is a bit of long question. I clubbed 3 questions now to make it one single question. And then I expect a short answer from you. We have been taught to be patient-centric, number 1. Second thing is, now the world is moving more towards data-centric and AI-centric. Is the medicine going to change? Do you really feel AI is going to fake the emotions? Then how in the world the true art or the sanctity of the medicine is maintained? So it is a combination of total 9 questions. This is the best I can put it across, Venkat. Want to have your opinion on this?
The succinct answer, Dr. Suresh, is no, N-O. If you want me to elaborate, I'll be happy to do that.
Please elaborate. Please elaborate.
Yeah. So, the human, there is a problem in AI that the world is currently grappling with. All the experts in AI are currently grappling with. It's called the hard problem of consciousness, right? So human beings have always been thought of as sentient beings who are aware or beings who are conscious. Right now, the biggest question that the AI experts are grappling with is AI conscious? Right? It's called the hard problem of consciousness. And in all the research that they have done so far, right, from both the Eastern wisdom as well as the psychology of the West, right, the current answer is that it's a big no, right? AI can never replace a human being. AI is only an enabler. And I will give a very, very simple example that, all of us use AI as co-pilots in Google Maps every day. So the question simplistically is, can Google Maps ever replace human intelligence? No. Human intelligence uses Google Maps as an enabler. And if there is a red, traffic signal, we know the lay of the land to kind of take a circuitous route through the residential area and then rejoin the arterial road 2 or 3 kilometers down the line. So what more proof do we have that human beings are always superior to AI? On that note, thank you, Dr. Suresh.
Great. So just to paraphrase what Mr. Venkat is trying to say is, medicine is still going to be patient-centric, not data-centric, AI-centric. Data and AI will help to refine our judgments for the patient care in a better way and not beyond that. The moment we reach level 4, 5, I think Dr. Gupta on November is going to teach us on how to evolve ourselves as a better AI doctors. So that's a great thing. So I'll take 3-4 couple of questions of things from myself. So number 1, there are a lot of questions regarding, will you get the PPT? The answer is, we are going to make a very simple repository and upload most of the PowerPoints on the NBEMS AI Sangam portal. So it takes time. I'm not promising that you will get it tomorrow, but you will get it. But what is readily available is all the lectures on the YouTube. You can see it. All 20 modules are available on the YouTube. Second thing is the question paper having any grading? No. It is a self-assessment, pass or not pass. You have 3 attempts, not 1. So you can keep on taking it till you have at least 50% of the marks. And for those who haven't attended at least 75% of the things, if you have crossed the 60% mark, you still get the participation certificate. And whatever you are going to get today is only limited to today's session. The actual exam will start from tomorrow, 12 o'clock onwards. It will be available for a week on your login. And the moment you finish it, you can download your certificate automatically. There is a lot of interest and then push from the participants to have a specific segment related AI courses. Again, we have been requesting our president and the team members, because you don't know how hard the NBEMS team has worked day and night to make this visible. We are working towards it. We requested and the process is on. I can't give the answers when and how it is going to be. But people like Venkat, RP Gupta, these are the people who came without expecting anything, but it is difficult to get their time also. So domain specific things will take some time before we launch it, right? So final exit exam, why we have not done so far is because from 10th to 17th, you can have the time to finish your AI online curriculum. 18th onwards, actual exams are going to happen at DNB. So we are going to finish everything well before this. New program schedule will be announced on all of your mails. Coming back, Venkat, to the questions, right? People say cognition. Okay, how does AI does the cognition at a gross level, and where does that path of human touch and cognition comes when they are building a team in a hospital?
Okay, great question. I think I've done some work. When we start learning about AI, right, we have to understand that AI is modeled on, artificial intelligence is modeled on natural intelligence. So in natural intelligence, there's a phenomenon that most of you may be aware of. There's a term called cognitive flexibility, right? And what does cognitive flexibility mean? Cognitive flexibility takes the various centers of the brain, right, like the prefrontal cortex, the medulla oblongata, the various sections of the brain, and attributes functions to those sections of the brain, right? And AI, through the neural network models, so when we do deep learning, TensorFlow, we pass the data, the raw data, historical data, through various layers called the neural networks, right? So the neural networks are simulated based on the actual brain, right? Therefore, whatever is the cognition and the cognitive intelligence that is associated with the natural brain, in some sense has already been translated through the machine learning programs into the neural networks and hence into the artificial intelligence realm, right? So thus the correlation is a direct one-on-one correlation. While you cannot 100% attribute the artificial intelligence to all aspects of natural. For example, it may lack common sense, right? A simple example would be, if I go to a restaurant and order masala dosa, and then I tip the waiter a hefty 100 rupees, right? So if AI looks at the sentence, Venkat goes to the restaurant, he orders masala dosa, he tips the waiter 100 rupees, right? It will not have the common sense to understand why Venkat tipped 100 rupees, because I missed the sentence that he found the dosa tasty or he found the service great. But a human brain would be able to plug that gap, right? That gap is something that increasingly in the fourth and fifth levels of the pyramid that Dr. Gupta is talking about, I see AI occupying that position. Over to you, Dr. Suresh.
That's probably the closest best answer which we can correlate in the real life example, right? So thank you very much. And then probably we will end this AI course and over to National Board. If at all they want to just comment on when the live question paper will be there, sort of thing. Over to you.
Thank you everyone for joining this session. Thank you, sir.
Thank you very much. Bye-bye.
Thanks, everybody. Bye-bye. Thank you, Dr. Suresh.
Thank you, sir.